What's up guys, Zach here with Dr. Eyeball MD. Today I want to talk about 5 things to consider before you pick a residency. If you're new to the channel, welcome. My name's Zach. I'm a second-year ophthalmology resident, and I'm going to talk about picking a residency and some of the things that might be useful to look out for as you're getting ready to go on interviews and that kind of thing. This applies really to any residency. At least 4 of these tips do. One of them is a little more geared towards surgical residencies, but the other 4 I think you probably should consider regardless of what type of residency you're going to go into. So I will start off with what is probably the most important. It's kind of a combination of the happiness and satisfaction of the residents. And nobody's end goal is to be a resident. You're obviously doing that to get through to the next thing, whether that be fellowship or a career in whatever field you want to pursue. So it's not going to be that you're going to be happy and enjoying residency all the time. You know, it's hard. You're really learning a new skill, and to come out the other side a whole new person. Limit yourself to looking for residents that are just insanely happy. Realize that residency has its ups and downs, and that happiness itself in residency is not kind of the end goal. If you can find it, definitely look for it. But the other part of that to look for is resident satisfaction with what they're learning. Are they satisfied with what they're learning? Are they satisfied with the amount of didactics they're getting, the amount of surgical exposure if you're in a surgical subspecialty, that kind of thing? Are they happy with that part of it? Because in the end, you're not going to be in residency forever. So you may have some low points in the residency, but if you come out of it well trained and the residents there are at least satisfied and happy with what training they're getting, even if they're not necessarily happy and loving what they're doing all the time, then I think that's an important consideration. Number 2 thing to consider when you're going and looking at residency programs is, what are you looking for after the residency? Again, you're not going to be a resident forever, so are you looking to do a fellowship to further subspecialize, or are you hoping to just practice right out of residency for whatever specialty that may be? Deciding to do a fellowship, look at the match rate of the residents that are graduating that residency program. If the residency that you're going into doesn't produce a lot of fellows in whatever subspecialty you might want to do, that's something to consider. So for me, in ophthalmology, if, coming into ophthalmology, I think I might want to pursue a retina fellowship after residency, or maybe an oculoplastics fellowship. It might be not a bad idea to look and see, well, has this residency program had a good track record with graduating residents who then go on to do the fellowship that I want to do. And maybe you don't want to do a fellowship and you just want to practice after residency. It might be a good idea to look and see, well, how well do the graduates of the residency program do with getting a job? So if you train somewhere like I've trained in ophthalmology, even coming out of just the residency without doing any other further subspecialization, if you're going to do comprehensive ophthalmology, people know the reputation of the program and how rigorous it is surgically, and so they're happy to hire graduates coming from this residency program even right out of residency without experience out there in the world somewhere else. I've known of places that have hired people from this program that have never hired anyone straight out of residency before, but they've done it from this program because they know how surgically rigorous it is and how surgically competent the residents that come from here are. So it's a good idea to look at the residency program if it prepares you well for either a fellowship or a job, and see how well it has matched people into careers after the residency. The third thing to consider when you're going out and looking for a residency program is the amount of autonomy. Now, this is going to vary a lot across residency programs, and it varies a lot based on whether or not you're in more of a private setting or an academic setting. Now, most of the time you're going to be in an academic setting or some combination of private and academics. So the upside really of having a more autonomous program, meaning a program that lets you do more, have more of the decision making, and really take that primary provider role rather than being more of the reporting to an attending physician role and letting them make more of the decisions. When you have that more autonomous role, it makes you make the decisions, and it makes you really think harder and kind of actually get to know yourself as a physician and kind of understand what your thought process is and how you want to treat patients, rather than falling back on attending physicians' ultimate decisions all the time, and then you get out into the real world and realize, oh, that you have to make these decisions by yourself. Now, there is a balance to strike between too much supervision and too much autonomy. And the upside to a more autonomous program is that you're gonna, like I said, get the chance to make more decisions and really grow more as a physician, I think. The downside to being more autonomous is that it's very difficult in the beginning, and it can be a lot more stressful. But in the end, I think you probably come out more confident and more competent. The upside to being in a program that's a little more supervision heavy is that it can be a little better sometimes at giving you more training and more coaching, and rather than you kind of figuring out the way to do things, sometimes you get coached through it more. So you just have to figure out exactly what you're looking for, and that's not easy to know all the time as a medical student. But just try to gauge where you fall on that spectrum in terms of wanting more autonomy or wanting more supervision, and then try to fill out a program in terms of which side they lean to for that. Just something to consider, how autonomous is the program. 4 is to consider the type of work that you're going to be doing at the program. Now, in residency, you're going to be doing some scut work. You're going to be doing some of the stuff that the attending physicians don't want to do, or that the fellows don't want to do. It just falls on you, and that's just kind of the hierarchy of medicine and something you have to go through, kind of like a rite of passage. But what you don't want is for an excessive amount of that to take away from the training. So to give you an example, for me in ophthalmology, when I'm in the clinic, if I'm having to tech up every patient, do the visual screening, do the OCTs, do all the testing, that's good to know to a point. You want to be spending a significant portion of your time doing things that technicians or nurses could be doing when that's going to detract from learning to do things as a physician. Luckily, where I train, we have a lot of support in that regard, and so that's something I'm very thankful for. But just look at the residency program that you're going to. Are they going to have you doing so much scut work that you're not even learning from to use you as cheap labor? That's something you don't want. You want to make sure that even if they're going to have you doing some of that stuff, they're also going to be training you and giving you time to learn. You don't want to be in a situation like that where you're not getting a chance to learn because you're doing too much scut work. So that's just something to consider. Look at the type of work the residents are doing. Number 5, and this applies more to a surgical subspecialty, look at the surgical numbers, and then look at how much of those surgeries are the residents actually getting to do. So it's important to consider, if you're going to go to a program and want to come out and be competent to do the surgeries that that your specialty requires, you want to see how many are you doing in residency, because after residency you're not maybe going to have a lot of supervision to coach you through those things. So to give you an example, for me in ophthalmology residency, if I'm looking at 2 different programs and one just meets the minimum cataract surgery requirements for a resident, somewhere around 90, versus a program like where I go, where residents frequently will get in the mid 200s to 300 cataract surgery range, it might be a good idea to consider a program with that higher surgical volume. Now, if you're not going into a surgical subspecialty, then look at other metrics of the program in terms of things you want to learn, whether that be time on certain subspecialty rotations or time doing whatever rotation you think might be helpful for your future career, or maybe even look at procedures that you might do, like in something like internal medicine or emergency medicine. Are you getting to do a lot of procedures as a resident in those situations? And also make sure to ask about these procedures, like I said, and these surgeries. What portion is the resident doing? Programs may be reporting numbers that seem really high, but then you learn that the residents are either just assisting or really not doing the lion's share of the procedure. So try to gauge how much of the procedure the residents are actually doing. Just 5 considerations to take into account when you're going on these residency interviews and looking at a program. I would caution you against just ranking a program based on its reputation, and whether it be through like Newsweek rankings or something like that. At some point in your training, you're gonna have to get to the point where you're evaluating a place for its merits and what it offers, and not just its reputation. Look into the things that are important to you and see if the program offers that. Don't just go based off of reputation. That can be important for helping with fellowships or jobs, but it's not everything, and would recommend to you to at least consider some of these other things because in the end they're going to be more important. And lastly, as a bonus tip, I would say just go with your gut. If you have the chance to go and interview at a program, just get a sense of what you felt like while you were there. And I would recommend actually writing that down, because when you come back trying to decide on a program and make your match list, you're gonna forget kind of exactly your gut feeling from the interview day. So I would just say, write down the program name and then write the overall impression and feeling that you got. You're gonna have a tendency to want to write down numbers and specifics and all these things, but in the end, probably the most important thing is just to write down the gut feeling that you got from the program. Guys, I hope you found that helpful. I remember it being super overwhelming and stressful and not even knowing really what to look for in a program. So I hope that was somewhat informative and just gives you at least some ideas of things that might be important to you when you're trying to pick a residency program. You guys will do great out there and match into a place that you love. I hope you found this video helpful. I'm Zach with Dr. Eyeball MD, and I'll see you guys in the next one.